How would you like to pass SCA and finish your training? Today I'm joined by Dr. Emma, who failed the SCA exam with score 69. She was desperate to pass her exam and finish her training. She had to go on maternity leave and was advised not to sit the exam. In this case study, you're going to learn how did Dr. Emma went from a score of 69 to 86. Make sure you watch the video until the end. Hi, Dr. Emma. Congratulations on passing your exam. How does it feel?
Thank you so much, Dr. Kwun. It feels like a big relief, a very, very big relief. Thank you so much for helping me pass this exam.
Today, we're going to dive deep into your preparation. What did you do, the strategies, and how you pass your exam with good scores. So tell us a little bit about your background for people who might not know you.
I'm an ST3 in the East Lands, and I've done this. This is my third attempt for the second part of the MRCGP exam. I did the RCA, but that was when I was pregnant, and I didn't pass. And then I did the SCA again in January and didn't pass. And I was also warned by my deanery not to try this exam again while on maternity leave. However, I was so desperate to pass this exam during maternity leave, knowing fully well that it's not about I've had enough exposure for patients because I've already done like 11 months of my ST3 before going on the maternity leave. So, and then I met Dr. Kwun for the third attempt, who reassured me from the beginning that I will be able to pass this exam in June. And here we are.
We can hear the baby in the background. So I'm sure it's been quite busy then, preparing while you have a baby. And how did you juggle this?
So it was a very difficult journey. I also have a very supportive husband who would help me with my baby anytime he's at home, because he knew that this is a very important step for me, and it meant a lot for me to pass this exam. And I had a discussion. I had so many, because I was at home and I wasn't working. I had so many discussion groups. I had to make a group with people who were part-time. Some people work on Monday, some don't work on Tuesday. So all those people, in their very free days, I have discussion with them, and then we discuss. Some people where when we discuss the NICE guidance just for very common cases, and then for some people, some days it's for the NICE guidance, some other days it's for practice or case on of cases on one-to-one, like how they put it now, case like discussion of cases, like trying to practice consultation skills and trying to perfect my consultation skills. Before my January attempt, I had the input of what they call the DA, is it differential attainment? But after my January exam, they all left me and said I needed to get back to work before I could do the exam again. But I knew inside me that that was not the problem. So when I came to Dr. Kwun, I saw a lot of difference from the way I did the SCA, the first attempt of SCA, and this one. There were a lot of differences, and I think that really helped.
Do you remember what was your score in the first SCA, Emog?
So I scored 69 in the first SCA. And the second one, and I scored 86.
That's a significant jump. So tell us about the challenges that you face when you had this exam second time.
My confidence actually dropped the first time, and I'm like, what else do I need to do? What should I do? I practiced. There were support from the DA sessions. There were people. I was discussing with people. Then what else should I do? I felt that I didn't know where else to go from here, until a friend of mine suggested that I speak to you, which then led to our meeting that evening. I think we met 2 days after I failed the first one.
Tell us about that this time round, like the second attempt. What were the things that you changed in your preparation then?
So the major things I changed in my preparation, one what I got from you was the structure. The structure of the whole SCA, especially the structure of the management plan. I knew there was a structure for the history when I went for the first one, but in the second one, I then also changed the structure of my management. So there is a structure also to management as well. There is one for history, there is one for management, and that makes a lot of difference and makes you more patient-centered rather than doing your own things, which was one of the major things I learned from your consultation skills.
So in the past, you were quite doctor-centered and you didn't structure the management.
No.
And then you learn about how to structure the management.
Yeah.
Could you lay your management plan as in how you structure it then?
So for the management plan, you need to address what the patient wants first, like addressing the eyes and addressing the psychosocial first. Only then will the patient be able to follow you. But if you address things, like if you just give the management plan for, say, for example, if it's depression, you just give that there is talking therapy and there's medication without even putting in what the patient wanted or what their idea was. It just sounds like you are on your own. But however, if you put in the eyes first, then the patient knows that you have actually listened and that you know what they are thinking, and you are putting everybody together rather than just doing your own things, if that makes any sense.
So what you are doing is readdressing the patient's eyes first so that
Mm-hmm.
you and the patient are on the same page.
Yes.
Then you got shared understanding.
Yeah.
Afterwards, then you can move into the shared decision making.
Shared, exactly.
Great. So if we look at the three domains then, tell us about the relating to others domain, which is a common challenge for many IMGs. How do you boost your score in relating to others?
My relating to others score was really surprising because I didn't feel any case with relating to others. I either passed or clear passed all my relating to others, which is quite a surprise for me as an IMG. So I felt that if you get the eyes earlier on and you're able to clarify that in the body of your history, and then come to management and manage the eyes, manage their belief that maybe the patient, sometimes they'll mention something in passing which is not actually in passing. It's purposeful, because this exam, everything that the patient mentioned is purposeful. Nothing just happened because it happened. It were all planned and programmed. So if for instance, the patient might be taking maybe an NSAID and just say it in passing and shouldn't be taking this NSAID, for example, if you need to address all these things, it means that you are correcting their belief and that you are working with the patient. I don't know if that makes any sense. Just listening to your patient, showing that you have listened, is what is very important with the relating to other side.
Great point. I think it's really important to practice and train yourself to listen so that you can pick up these cues. Otherwise,
Exactly.
you might miss the cues and then miss an important aspect of a consultation. I
Yeah.
think you learn to respond to these cues and pick it up. Another thing that trainees struggle with is how to empathize where it's naturally. Like sometimes people say, "I'm sorry to hear that," but it sounds quite formulaic. Tell us what did you do?
You need to be present and mean what you're saying. Like, it doesn't have to be you're sorry. Even just the sounds and that you're making makes more difference than just saying sorry to hear about that. Just something like that means you are present and you mean what you're saying, and it's coming from the depth of your heart. That's what is important in this exam for relating to others.
You have to speak from the heart, because sometimes when you're so stressed under exam condition, you might speak from the head and you just say things that you think that's the right thing to say.
Yeah.
But how do you manage that exam anxiety then, Amog?
So that was really one of the challenges I got. So what I did was to work on my mindset, to remind myself of things that I've done in the past, greater things that I've done in the past, and then do some breathing exercise. It was really difficult for me that I had to take propranolol as well. If you think you are really anxious, you need to speak to your GP, and that may help you.
Absolutely. So you got professional help, and that allowed you to cope with the exam anxiety.
Yeah.
Tell us about a few days before the exam. Was there anything in particular that helped you?
Well, I had my practice partner, and one thing we found that if we don't practice, like say 1 or 2 days before, you notice that the next practice, it shows that you are not flowing, which means that you haven't been practicing. So we even practiced on the day of the exam.
Okay.
1 or 2 cases. If you have the afternoon session, I had afternoon session, so 1 or 2 cases just before your exam, it puts you in the flow of the consultation and you flow better. That's what we felt, and it helped me and my partner who also cleared this exam.
When you sat the exam, did you feel like there were things that you were not sure? So how do you manage unknown and uncertainty?
So there were questions. So one thing also that's important in these exams, if a patient is asking you a question, it didn't just happen. It didn't just, it's not all of a sudden the question came. It's a question that you must answer to pass this exam. So if a question asks you a question you're not sure of, you need to be open and sincere. I hear that you're wanting to know this. However, that's something that is not very clear on my head. Is it okay if I read up on that and give you a ring? Or is it okay I read up on that? And then when I see you in so few weeks, then we'll have a chat about it if it's something that bothers you. Just be open and sincere, because you can't know everything. That's just the truth.
So it's really important that you inform the patient how you're going to find out about it and come back to it as well. So from what I'm hearing, sounds like you were comfortable to be able to say, I'm not sure about this, but it's more
Yeah,
about how you say it and
yeah.
being confident and assertive in when you're saying it.
Exactly. You need to be comfortable with saying it and be assertive, and no, showing that you want to also know what it is now that you don't know. Just showing that you're open enough. That's it.
Negotiation is a skill that's assessed in the exam. Were there anything in particular that you found useful to negotiate any requests?
So negotiating is like you need to find a common ground with the patient. You also need to be open-minded as to patient's requests. So in this case, it's not about arguing with patients that you don't want to do what the patient wants, because sometimes what the patient wants is actually the right thing to do. So being open-minded, having a common ground, then agree with the patient and then be able to move forward. Because if you want to argue with the patient as to if the patient is not right, then you might be getting into trouble, really.
So it's very important to find common ground, ensure that you're listening and align yourself with the patient's interests, showing that you're working together to find a solution, as opposed to
Exactly.
trying to confront the patient and trying to
Yeah.
argue. So if you had to look back then, what are things that you would have done differently, Emog?
I'm not sure what I would have done differently. Was like remaining calm, because even with the relax, I wasn't so relaxed because there was still exam tension, and if I were to be more relaxed, I would have scored even better. But trying as much as you can to be relaxed, because then only then would your empathy show fully. That's what I think.
Yeah, this is really common thing I've observed among trainees. So when you're so tense, it's very difficult then to get that flow in the consultation. And sometimes you second guess and it's not flowing very naturally. Whereas if you kind of relax a little bit, be present and embrace the challenge, then you're
Mm-hmm.
more likely to do well.
Yeah.
So share with us if you had to give piece of advice to a GP trainee who was not successful and thinking of sitting the exam, what would you say to that GP trainee?
So I will tell, because I've been in that position before, I will tell the GP trainee to take their time and not rush it. Even if you scored 1 mark or 0.5 below, there is a reason why. You need to relax and look for someone, maybe a mentor like Erwin, who would help you through your consultation skills. Because rushing back may be another recipe for even failing worse than you failed before. That's what I will say. Giving yourself time to change your strategies is very important.
So we'll talk about the mindset that you had to change, the strategy, and also how you approach this exam. It looks very clearly that you gained so much confidence in this
Yeah,
process.
yeah.
Tell us what are you looking forward to?
So I'm looking forward to so the most important thing that gave me the push to keep sitting this exam in maternity leave was I wanted to be able to take care of my kids, which is it was something paramount. And I told you on that day, I need to free myself from this exam and take care of my kids. So I would certainly be going part time and I'll also be looking at doing GP with special interest in dermatology, which is also a passion for me.
I'm really excited for your future.
Yeah, thank
And
you.
yes, once you've got this exam out of the way, then you have more freedom to choose and do other things.
Yeah.
So it's great to see that this weight has been lifted off your
Yeah,
shoulder.
thank you so much.
I'm really pleased to see that you've managed to pass. And if you found Dr. Aimog's story useful and you want to get help, I'll leave a link down in the description. Just click the link down below and we'll see whether I can help you pass your exam. So thank you very much, Aimog. I'm so glad to see that.
Thank you so much for
pass your
helping me,
exam.
Dr. Kwun.
Take care, everybody. Bye-bye.